Can you hear me? I just want to let you know I can't turn on the camera. I tried to get on my iPad and it wouldn't let me. So I don't know like if you can see me, but I just want to let you know I'm not visible by my camera.
Yes, we can hear you.
Okay, and is it okay since my camera's not working? Is it okay that I still be here?
Absolutely.
Thank you.
Hi, everyone. Can you hear me? Hopefully so.
Yes.
Hopefully I will. Okay,
can hear
great.
you.
I was going to say I'll take your silence as a yes. I am just pulling up the slides. I was in another meeting, so I apologize for being a minute late. It is great to see all of your faces, all of your pictures, all of your names on the provider call. We have a very robust and interesting agenda today. So before we start that, I will just take you through some housekeeping stuff. The first thing is that we all know this time is for you. So use this time, ask each other questions. If you see somebody's name on this call that you recognize and you want to know more about them, feel free to reach out. Feel free to ask questions. We are here to help. If we can't answer your question, then we will email you later. The other thing is really try and mute yourself if you're not speaking. This is an opportunity for you to learn more and ask questions, but if somebody else is speaking, just wait until they're done. You can ask questions by raising your hand. You can type a question in the chat. And you know what? We are sometimes going to interrupt each other. I am terrible at this. I'm working on it. Sometimes it's better. Sometimes it's not better. So it's not the end of the world if that happens. So I will be doing the welcome. My name is Melissa Temke. I am the Behavioral Health Communications Manager for the Healthcare Authority. We are going to have Tony Walton on today, who's going to be taking us through our section highlights, as well as Sonia Pipik, who will be taking us through the mental health and prevention and promotion. Maureen Bailey will take us through recovery support services. Diana Cockrell will take us through prenatal through 25 updates. Nicole Mims will take us through diversion and reentry, and then Alex Stoker will take us through adult and involuntary services. After we get those great updates, there will be a brief time to ask some questions if there's something burning that you want to talk about. And then we will move on to a summary of the CDISA program with Michelle Martinez and Kelly Sandiker. And then we will end the call with a presentation from Rex Rempel on the behavioral health workforce and community colleges. And then there will be more time for questions and discussion. And I'm so happy that you're all here and really excited to start the call. So with that, I'm going to go ahead and introduce Sonia Pipik with the Substance Use Disorder and Mental Health Promotion Program. Welcome, Sonia.
Thanks, Melissa. Good afternoon, everyone. Sonia Pipik here. With the prevention section, we have just two small things we wanted to share out with folks today. First, last week, we had our Coalition Leadership Institute. We brought together over 100 folks from across the state that support our community prevention and wellness initiative. Those providers came together to learn. We had experts from the University of Washington Social Development and Research Group, as well as Washington State University's Impact Lab come and train both our team here internally at DBHR, as well as our providers on best practices moving forward and identifying needs and how to address them in their communities. So we're really excited. We had wonderful feedback. We also had some other presentations that took place during that time. We had the strategic plan from our prenatal to 25 section, the Washington Thrive, that was presented to our whole field so we could try and really gather additional support for that. We also had a great conversation from Melissa yourself, as well as our partners at DH on the Friends for Life campaign and proper utilization of that in communities across Washington. So it was a great 3 days that we had together. And then finally, just a reminder for folks on the call, if you're not aware, and some of you may be, we have our annual Prevention Summit, which is coming up this fall. It will be hosted in Seattle this year, downtown at the Westin. And that event is taking place October 30th and 31st. Registration is open all through the Prevention Summit website in the chat box. So if you want, you can just click on that from there and you can check out that event. Hope to see folks there. And that's all I have for prevention today.
Thank you, Sonia. That was great. That's a lot of great information. And it was an awesome event. The Coalition Leadership Institute was great. So thanks for letting me present. So next up, we have, I believe, Tony talking about adult substance use and treatment. Welcome, Tony.
Can you hear me? There we go. Can you hear me?
Yep, I sure can.
All right. Wonderful. Good afternoon. My name is Tony Walton. I'm the section manager for the Adult Substance Use and Treatment section within DBHR and have a couple of updates for everyone today. One is just a reminder that the training around the 4th edition of ASAM criteria is underway and moving forward per 6228 in that legislation. Washington State is directed to implement the 4th edition by January of 2026. So this training is definitely helpful and critical in meeting some of those obligations and requirements. There is a contact email address there if you have any questions or want any more information about the training. And so appreciate everyone's attention to that. Also wanted to highlight that there is a new dashboard from the Center for Disease Control and Prevention related to overdose deaths. Washington State is one of 33 states that is sharing data with CDC to ensure that there is inclusive data that's summarizing not only overdose deaths, but also overdose incidents across the United States. And so really critical to have access to that up-to-date information when trying to evaluate the impact that drugs, not only fentanyl and opioids, but also methamphetamine are having, not in Washington State, but across the United States as well. And so there's a link for more information about the drug overdose surveillance and epidemiology dashboard there, or DOSE. And then finally, just a friendly reminder to everyone that this August 31st is International Overdose Awareness Day. It falls on a Saturday this year. This is an annual event where we take time to remember and reflect upon the lives of individuals and friends and family that we've lost to overdose. And also to help address stigma, to break down stigma in the community and remind everyone that overdose death and overdose is preventable, and we can also respond in a way that can save individuals' lives. And so just really critical to participate if you have an event in your community, and at least just visit the website and learn more about International Overdose Awareness Day. There's a lot of great resources there, good data to look at, and some additional information around how the International Overdose Awareness Day is celebrated and helps to break down stigma across the United States and the world. So I think that's pretty much it for our updates. And so, Melissa, I will pass it back to you.
Awesome.
Question.
Thanks,
I got a
Tony. That's great.
question.
Oh, yep. Go for it. Go for it.
All right, I got to break up this party a little bit. Thank you for sharing
Love
that,
it.
Tony. Not that long ago, I went on to look at when these trainings are going to be offered for the 4th edition of ASAM, and they were all jam full. Do you have any updates regarding when the next series will be offered?
Yep, we do. There's a Gov delivery that's going out later this afternoon, and that has the updated FAQ. And there are many, many trainings being offered in October, November, and December. There's also the Tier 3 trainings where before those were to be determined. Those are now back on. So watch for that. Yeah.
Thanks for the question, Tori, and thanks, Melissa.
Awesome. Okay. Thanks, Tony. Any other questions? I know that ASAM we have had kind of my fault, I think, that with the trainings and things, I think we are under control now. So thanks for your patience with learning about when those trainings are happening. Okay.
Melissa, real quick,
Yeah.
it looks like Amy has her hand up and might have a little more information.
I did not even see that. I apologize. Go for it, Amy, if you have more information.
Thank you, Tony. I just also wanted to let everyone know that there's going to be several rounds of trainings coming out. So we finished we're almost finished with the first round of trainings, and we're going to do, like Melissa said, we're going to send out a second wave of trainings for everyone. And then there's going to be a third wave of trainings and a fourth one. So there are more trainings coming. So if you see that the trainings are filled up, do not hesitate. I did put my email in the chat, and Tony provided the inbox for ASAM as well, but there are more trainings coming. So we have a lot, so don't panic, but if you need some reassurance, please reach out to me, and I'm happy to discuss that and make a plan for you and with you, and also kind of let you know when the next ones are coming out. So thanks for your patience, and I'm just so glad that all of you are participating and signing up. It's I'm really grateful that everyone's getting the training and preparing.
Thanks, Amy. That's helpful. Okay. So what about recovery support services? I believe this is Nikki.
Hi, Melissa. This is Mo Bailey. And I'll give
Moving! Sorry.
I'll give the update
So
on
happy
recovery
that you're on
support.
the call. Oh,
No
I
problem.
don't have my little agenda handy, so I was guessing. It's good to have
Can
you.
you go back to the RSS one? Perfect. Thank you. So I have 3 things to talk about today. So we have our peer employment database that launched in June. So this database provides a centralized resources for individuals seeking employment in peer support and organizations seeking to hire peer specialists. The database aims to enhance the workforce development by promoting careers in peer support, ensuring that individuals with lived experience can contribute to the recovery services and support others on their journey to wellness. The link is here on the slide deck you'll be receiving, as well as you can find it connected to the Washington Peer Network. We also have 2 programs that were launched this last year. One is called PRE. That is our Passageways to Recovery Through Employment and Education. This program launched last December. And to date, we have served 357 people, and 59% of those enrollees identified as coming from underserved communities. What's really exciting is 110 of those folks either have employment or education starts that have been reported so far. We also have been provided some SUD housing subsidies that are focused on the 5 most populous counties in the state. So we launched these subsidies back in January, and through the first 6 months, there were a total of 1,046 enrollees, with 41% of those enrollees identified from coming from underserved communities. And 84% of the people served were either homeless and secured housing or were diverted from eviction. Any questions?
That's really great, Mo. Thank you.
Thanks.
Any questions about any of these things before we move on? Okay. All right. Up next, we have Diana Cockrell.
Hold on. Sorry, I couldn't find my mic.
Is there...
I'm just a
Okay, no
disruptor
worries.
here. So
That's okay.
So
That's
my
what this call is
question,
for.
yay. So my question regarding this is great to be on these because I get to see what's going on in other corners here. My question regarding the housing subsidies, what type of housing was that? Are we talking about? Are we talking about clean and sober housing, recovery housing, apartments? Can you share a little bit more about that?
It's all types of housing. So it's whatever the individual wants. So it's, housing first. So we want to make sure that folks are getting into the housing that they choose to get into. We also have dedicated subsidies for recovery residents in Oxford House. And if these folks choose to go into that setting, they're more than welcome to go in that setting as well.
Okay, thank you.
Welcome.
Thanks, everybody. Okay, are we ready to move on to prenatal through 25? All right. Diana, take it away.
Thank you. Hello, everybody. I often feel so lucky to get to be part of this constellation of people. Thanks for having me today, and thank you for being here. 2 things I want to tell you about that you can join in and learn more that we have coming up. One, Mobile Response and Stabilization Services webinar series. This is the best practice intervention response for families and young people, nationally recognized as a best practice that is rolling out across Washington. So if you want to learn more, hear a discussion, be part of a Q&A, it is open. You don't have to know anything to be there. You can know a lot and show up, and I think there'll be something for you. So there are links on the slide to participate in that. And the other piece I wanted to share with you, thank you, Sonia from Prevention, for shouting out the Washington Thriving, which some of you may remember. We did a update to this group that was a little longer presentation on the Prenatal to 25 Strategic Plan Advisory Group. That is a subgroup of the Children Youth Behavioral Health Work Group, which is a governor-appointed, legislatively directed policy group that pays attention to prenatal through age 25 behavioral health. Year before last, or last year, sorry, with state fiscal years, I get a little off center sometimes, put into place legislation that requires the state to come up with a strategic plan for prenatal through age 25 behavioral health that initiative has changing its name to Washington Thriving. So when you hear that, there's the connection for you, if that helps. There are several ways to engage. What makes this plan and opportunity unique, and I think once in a career opportunity, is that it is designed and intended to be centered around youth and family, young adult and family and caregivers' voice. The real key folks, that frontline direct service delivery system people that are part of that, and the people experiencing the system are really what we want to center around what the vision is, what should this care look like, and build that plan from where we are to what it should be. That's what the effort underway is. There's ways to join. You can be on the mailing list and just see what's happening and join in when you want to. There are discussion groups that are tiered out: youth voice, family caregiver voice. And then there's one that's called System Partners, and we really are looking for providers to be part of that. So those subgroups of the Strategic Plan Advisory Group get content that's being delivered or developed by our contractors around landscape analysis, ways to tell the story through data, visioning, and offer feedback on it from their perspectives. There is also the Washington Thriving website, which is here. So you can just go learn some more, share it on your social media, and really sharing with networks and with folks that you work with who are, for good reason, not probably paying any attention to what we're doing at the state, because they're doing the work right now. If you could help us invite them to these tables so that we get to hear their voice as well, that would be awesome. All right, that's what I have for today.
Thanks, Diana. That's great. Any questions about prenatal through 25, work groups, anything for Diana? Okay. Thank you, Diana. That's really great information. Okay, next up is diversion and reentry. Who is talking about these talking points?
That would be me, Melissa.
Yay! Okay. Welcome.
Good afternoon. Thanks. Good afternoon, everybody. My name is Nicole Mims, and I am the section manager for the diversion and reentry section, our newest section here at the Division of Behavioral Health and Recovery. Few updates for you all. The Pioneer Human Services SUD Peer Bridger Pilot Program, currently funded for 8 SUD-specific Peer Bridger positions. With the additional funding, they will be able to widen their scope and provide indispensable supports to people over 20 counties. GAP funding was obtained for this program to continue until June 30, 2025. The diversion and reentry section continues to facilitate and coordinate patient and social worker education sessions at both Eastern and Western state hospitals, with the goal of providing insight that will help connect civilly committed patients to community-based services and supports as close to admission as possible. The peer respite model was showcased recently at a collaborative conference for community members, which included sharing how peer bridgers and peer respites have made important connections in the Spokane region. And last but not least, in-person and virtual provider outreach sessions were conducted for foundational community support providers in Eastern and Western Washington. These such sessions introduced FCS providers to the new FCS hospital liaison role. They are giving providers the opportunity to inform important processes in an effort to facilitate the best possible collaboration across multiple complex systems.
Awesome. Thank you. Any questions for Nicole? Okay, thank you. That's great information. Appreciate you being here to present. Okay, and then we have the update on adult and involuntary services. Who is the lucky participant who's going to share?
That would be Alex Stoker.
Hi, Alex. Welcome.
Hi, Melissa. Thanks. I'm Alex Stoker. I'm the Adult Services Supervisor. I'm Cara Panic's stand-in today. We have a trio of updates, one of which didn't make it into this version of the deck, but I will share with you all the same. So our second PACT symposium for nurses and prescribers was held on August 15th. We had 58 attendees, which was wonderful. Our Aristo IBHTF in Renton, IBHTF is Intensive Behavioral Health Treatment Facility, is now open and accepting referrals. I also want to highlight that the Washington COD treatment conference is coming up October 7th and 8th. As well as having some pre-conference trainings on October 6th. So if you're interested in attending, registration is now open for that. We have some really great speakers and we would love to see you there. Finally, we have the CCBHC update. For those of you who are not familiar with that acronym, it is Certified Community Behavioral Health Clinic. It's a national model that is currently attracting a lot of attention. And is, I would say, particularly well thought of in our local state legislature. We have a lot of support and funding for it, and we have been directed to launch by July of 2026. So many of you are likely participating in the work group currently to provide feedback on our report to the legislature. We will be continuing to receive feedback and continue planning into next year. So if you are interested in that, I'm going to put my email in the chat and you can reach out to me with any additional questions or if you want to participate in any of the future work groups.
Thanks, Alex. And there was a message in the chat wondering if you can tell us the number of beds in the Arista Renton Intensive Behavioral Health Treatment Facility.
I believe it's 16, and I think Jeff Landon is on and can correct me if I'm wrong. Jeff says correct. It is 16.
Awesome. Thank you so much. That's great. And thank you, Alex. Any other questions before we move on? Okay. We do have a brief surprise in our programming today, which is that we are going to be moving some presentations around. So I'm just pulling it right up here. And we are going to be starting next with the behavioral healthcare programs in community colleges with Dr. Rex Rempel. Welcome, Rex. And I'm just going to go ahead and share my screen again.
Thank you. Mind if I share screen?
If you would prefer to share, you're more than welcome to do that. That's great.
Thank you.
Take it away. Yep.
All right. Let's pull that up. All right. Am I sharing with you?
Yep. I can see it. Looks great.
Okay, great. All right. Good afternoon, folks. I am Rex Rempel, here to share about the Behavioral Health Bachelor's of Applied Science programs in our state. And I promise I will be brief and relevant. I know the need for staff, and I'm here to offer some help in that regard, I hope. And so just to let you know, my background is in clinical leadership in community behavioral health agencies here in Washington State. And when I moved over to full-time education 10 years ago, I came with the explicit intention to try to help devise a better prepared, more ready workforce for behavioral health agencies like those that I had been working in. And so that is what we've been working on at my college, which is Lake Washington Tech in Kirkland, and our sister schools around the state. So you may not know, but the big takeaway from today is that community colleges now offer baccalaureate degrees. Washington State does so more than any other state in the country, and these have been growing significantly in the last 15 years. Washington State now has a number of different Bachelor's of Applied Science programs, and health professions is practically in the lead amongst them. We now have a Bachelor's of Applied Science programs in all of our community colleges, all 34 across the state. Specifically, I'm here to talk about Bachelor's of Applied Science in Behavioral Health Care. We have them in operations at 5 different community colleges around the state. A 6th here in gray is starting up next month, and those in gray with dashed lines represent those that are in development or under consideration. So these are now being offered around the state, so probably in your region now or soon. What our programs focus on is behavioral health, which means that we are working at educating folks and developing their knowledge, values, and skills in the treatment of mental health disorders and in the treatment of substance use disorders, with attention to all of the affiliated and linked services that we provide by way of social services and healthcare services. So we do really focus on that which is germane to what your services are that your agencies are providing. The way we're setting this up is that this is competency-based education. I literally started by taking 100 job descriptions for a tri-county area around our college and pulling out all of the knowledge, values, and skills that you're looking for entry-level professional positions. We looked at what are the job skills and job duties, and we looked at what are the prerequisites or the qualifications for these positions, and we used those to devise curricula. Those became the competencies for our programs. We supplemented that with what it takes to earn the relevant credentials here in the state of Washington. And so these are designed to provide for people being capable and qualified to walk in on the first day and be ready to assist in your service provision. That's what the goal is for our graduates. And so you may very well see language literally from one of your job descriptions in our course descriptions or course objectives. Here is a look at some of the types of courses that are offered across the college's curricula. And so there is not fluff in our curriculum. They really are focused on job competencies. And so what that means is that we don't study dreams and we don't prepare people for music therapy, but really this is preparing people for case management jobs and entry-level clinician jobs. So we're focused on the treatment of mental health and substance use disorders, as well as the development of necessary professional skills, including ethics and understanding of the context in which our clients live. So they should be able to enter the jobs already well informed about how to do an assessment, how to devise a care plan, how to do documentation, and what the treatment options are for the relevant conditions. One of the things that we are especially enjoying is the addition of behavioral neuroscience to our curricula, trying to teach people how it is that the brain works so that they can provide psychoeducation to your clients. Almost universally across these community colleges, we're using clinicians to provide the education. This is intentional. We want people who have been in agency leadership themselves and had their own clinical practices themselves in order to teach students about what it's like in the real world jobs. So we can refer to directly what it is that they will be doing and need to be ready to do. These typically are licensed social workers and licensed counselors and substance use disorder professionals. Our programs require internships for our students or practica. These will be across our colleges, 240 or more hours spread across 2 or 3 quarters. Typically, students are placed in community behavioral health agencies or organizations. The idea is that they will grow into professional roles, moving from watching to helping to doing. And this practicum provides a bridge from school to employment is the goal. In many cases, we are finding that our students, in fact, are being offered jobs at these organizations before they ever finish their internship because the agencies are finding out that these folks are skilled and ready to go. There's a great deal of likeness in the programs across our community colleges. Essentially, of the 6 that would be operational this fall, 4 of us share nearly identical curricula, but all of them are built on the model of 2+2, where people get a 2-year associate's degree and add on another 2 years to earn the baccalaureate degree. People are coming with associate degrees in a variety of fields. Oftentimes it's substance use disorder studies, sometimes it's social or human services studies, sometimes they're coming from another health discipline such as medical assisting, maybe criminal justice. There is variety where they're coming from, but the baccalaureate programs, almost all of them are evening programs designed for working adults. Almost all of them combine some in-person coursework with online coursework, and they all operate with a cohort model. Our student body is one of our strengths. Traditionally, community college students have often been seen as less than, less prepared, less academically capable. We are finding that we have excellent students who come from a real interesting set of backgrounds. This map on the screen here, those red dots show home for last year's new students. So these are the students in my program last year and where they called home. And you'll recognize they are people coming from around the world. And so this means they bring not only multicultural experience and understanding, but typically multilingual abilities as well, which is awfully handy when it comes to service provision. Further, these are a broadening of the workforce in our profession. I know, having myself been a clinical leader, there's a whole lot of wonderful 27-year-old white women providing our services. We can expand upon that. We've got a real diversity of ages. We have a diversity of linguistic abilities, a diversity of racial identities. We have a whole lot of people who come with their own personal experience of behavioral health conditions and or their family members. Community colleges have a high rate of poverty amongst the student body. That is one reason we are attracted to them, is that we are economical or affordable. This does mean that they have lived experience that they draw upon when it comes to familiarity with applying to DSHS benefit programs, for example. So our student body is actually one of the strengths that we can offer you, a diverse workforce. Students like us because we're low cost. Not only are we in their community, providing a less intimidating environment, but they can do this as working individuals who themselves are not well off. And so this makes us attractive to them. We have been placing seniors into internships now for 7 years and sending our graduates out into the workforce, and we're getting excellent reviews, I can say. Our employers in the area are saying that our students are ready to go. They know how to do service notes. They know how to do assessments. They know how to build rapport with clients, and they're ready and understand the job. Our students and our graduates are saying that when they got out there to go to grad school or to go to the jobs, it turns out they were ready. They knew what they were doing. They knew how to do it. There weren't very many surprises, and that they were successful. They're saying that they appreciated that they had a learning environment that was small, where they felt they had personal relationships with each other and with their faculty, and they were well supported. Students who had struggled in prior education, be that high school or other college experiences, are succeeding here at the community colleges. And one of the things that we discovered is that people who used to say, maybe I could get an associate's degree, are now saying, I am getting my graduate degree. To date, in my program, I'm bringing in a 7th cohort this fall. To date, I have had 1 student who was not admitted to a graduate program when they sought it. And that was because we informed the graduate program that this student just wasn't ready. But our students are getting into social work and counseling programs in our area and around the country. And amazingly, what we're hearing from employers is that the interns who are our seniors are already on par with their first-year graduate students who are also interns at the same agency. And in fact, our students who go on to graduate studies are coming back and telling us it was kind of easy because we already learned this stuff. we were already ready for this stuff. So we're having great successes in that ways, I will say. To wrap things up, I want to say that we are here as community colleges specifically with the purpose of being relevant and helpful to our local workforces. That is our mission. And so we are here to partner with behavioral healthcare agencies. One of the most important ways we can partner together is through internships. We want to offer you our graduates as well-qualified people with a diverse set of identities. We are here to help provide education to your current workforce if they want a credential up, whether that's in substance use disorder credentials or whether that's in behavioral health credentials. And we are also the educator of choice for many of your clients. As a reminder, we exist not only in the Puget Sound area, but also down the I-5 corridor on the east side of the state, and we are growing into the middle part of the state. Those that are dashed lines are developmental as yet. The solid lines are those that are in existence. I encourage you to connect up with your local program to find out what's possible by way of your connection with them. And I am happy to try to take any questions I might have. And so let me look at the chat for starters. Dawn asks if a master's in behavioral health will be following. To date, community colleges across the United States have not offered graduate degrees. We are offering baccalaureate degrees now in 24 of 50 states across the country, but that is growing. I have checked, and there are no statutory limitations that would prevent community colleges from ever offering graduate degrees. It has not happened as yet, but I actually do imagine a day when that will happen. Are we including people with lived experience in these curricula and programs? You bet. And so a great many of our students have their own lived experience. A great many of our faculty have their own lived experience. And we bring constantly guest speakers into the classroom. I can say at my own program, we're bringing guest speakers in every other week. And these are oftentimes people that better represent not only our workforce, but our clientele and our student bodies. And so we're trying to bring in diverse workforce voices into the classroom, provide models. And so we are partnering up with NAMI, for example, amongst other places. Dakota, thank you. Do we survey any of the people they serve to know the effectiveness of their skills? Indirectly, we are getting feedback not directly from the clients, but from agency supervisors and agency managers, as well as the graduates themselves. But we are not ourselves directly in contact with the clients of the services. Tacoma Pierce County is not yet represented. That's something that you might want to be in conversation with Tacoma Community College about. They do have an associate's program already in substance use disorder studies. It would be fairly easy for us to support them in the development of the next level. They have not yet been in conversation with the others of us about that idea. I don't know if they're considering it, but we would certainly be standing by ready to assist them if they want. I thank you very much, Tara, for your question about connecting for practicum placements. That is our #1 request. Connect with us over practicum placements. And so if you are in my area, please contact me, my information here. If you don't see your area's community college, listed here, you can get in conversation with them about whether or not they are interested in developing a program. That is honestly what is happening. So Spokane, Tara, I would put you in touch with Spokane Falls Community College, specifically Ursula Heflick at Spokane Falls. But anybody's welcome to contact me for further information or ideas. I am at this point operating somewhat like a statewide hub for our behavioral health programs and helping organize them across the different colleges. We have now organized ourselves to have a common curriculum numbering system and sharing classes as well. And yes, Christina's mentioning, we have beyond these that are offering the bachelor's degrees. We have a great many more programs across the state offering relevant associate's degrees that are also wonderful sources of connection. Yeah, Kelly?
Yeah, so just a quick question. When people from the programs go into practicums and such, does it matter whether or not they're paid during practicums? Do you have one way or another how you guys feel about when I get one for my associate program at TCC, they allowed us to get paid, but I know some programs don't allow that. And I'm just curious for your guys' program, do you allow it or not?
Our college does not have a policy requiring or preventing paid internships. And to my knowledge, the other operational programs do not either at this point. There are advantages and disadvantages we have found, and so it tends to be worked out on the individualized level.
Okay, great. That's awesome to hear.
All right.
I'll just
Thank
close
you.
by saying
Oh,
we exist to support you all. And so please don't hesitate to reach out to your local community college and be asking for things. That's why we're here.
Awesome. Thank you so much. That was great, Rex. I really appreciate that. Next up, we are going to have Kelly, and he is going to be taking us through the CEDISA program. So I'm going to share my screen once again, and we will go from there. Okay, take it away, Kelly.
Thank you, Melissa. Thank you, Melissa. My name is Kelly Sandaker. I am the SURSAC Substance Use Addiction Recovery Committee and administrator, and I'm also the CEDISA Substance Use Disorder Intake Screening and Assessment Administrator. I've been at the HCA for about 6 months, and I've been in direct services for about 12 years. I've been in the field of addiction for about 12 years, and love doing it. And right now, I'm going to go ahead and take you guys through what CEDISA is. Next slide, please. Background and objectives. In 2022, Substance Use Recovery Service Advisory Committee, SURSAC, recommended that development of a work group to address barriers to SUD assessment across the state as part of the Substance Use Recovery Service Plan. In 2023, Washington State Legislature passed 2E2 SSB 5536, a section of which directed HCA to establish the CEDISA work group and gave it 2 primary objectives: broaden the workforce capability of administering the SUD assessment, make the assessment process as brief, low barrier, and person-centered as possible, including only what is necessary to manage utilization and initiate care. Next slide, please. Work group members included care providers, payers, people who use drugs, individuals in recovery from substance use disorder, and other individuals recommended by HCA. Additional areas of representation were decided by internal steering committee. Meetings are held for 90 minutes twice a month. And are open to the public attendance and observations. Public feedback is always welcome via email to the CEDISA work group administrator, who shares the input to share, and then I share it with the work group members. Next slide, please. Shortening the length of the assessment. The work group considered the length of the SUD assessment and options for shortening it. However, the ASAM 4th edition criteria established a new level of care assessment available to expedite treatment initiation, which will be adopted by the HCA in January of 2026. As these changes address the length barrier for SUD assessments prior to treatment initiation, the work group efforts have been focused on other ways to make the SUD intake screening and assessment policy as low barrier and person-centered as possible. So just real quick about this, in ASAM 4th edition, when people who really need the care, they'll be able to complete and if any of you gone through the ASAM training yet, you'll hear about this and about the new level of care assessment available so that people can get treatment quicker for the people who truly need it. Next slide, please. The first recommendation we have is increase the Medicaid fee schedule reimbursement rate for behavioral health services so that the behavioral health service providers, facilities, and organizations providing substance use disorder treatment can offer higher wages to substance use treatment providers and incentivizing more people to choose this career path. Next slide, please. Recommendation 2, education campaign to clarify state requirements related to intake and assessments that must be administered prior to providing different types of behavioral health services. So for instance, education to prescribers about Scalia Northwest program and removal of the X waiver. Scalia Northwest is a program that started that's for ERs, and they presented to CEDISA and to the SARSAC committee and work group. And Scalia Northwest, basically, if a patient ends up in an ER and the ER is working with Scallion Northwest, then the provider can go on this website, give them a lot of good information. I can post the website for Scallion Northwest on the chat. But basically, if this person says, hey, I really just want MAT treatment, Suboxone, then the ER provider will go ahead and prescribe the prescription, and then they'll call a phone number and they'll get them an appointment for an MAT provider. And so for this to work, the ER has to contact the AC at Scallion Northwest. And so that's the only way it can happen. So not every ER is doing this right now. And so the removal of the X waiver, as we know, some providers might not know about the removal of the X waiver. If anybody here on this call didn't know, the X waiver has been removed, which basically the X waiver was saying, if you were a medical provider or a PCP and you used to have go to a special training and do a whole bunch of stuff, get a certain thing on your card that says, hey, this means you can prescribe Suboxone, that no longer exists. You can follow protocols and prescribe Suboxone. And so we want to educate more providers on how they can gain more information about prescribing MAT treatment. Providing training, who can perform SUD assessments within scope. So for instance, if a social worker works at a behavioral health agency and has been trained in diagnosing and assessments, then they can do an SUD assessment. And so we want to make sure more people know about that and to get those folks some training so that they can do more of that. That's not necessarily to replace SUDPs or anything like that. That's just so that if someone needs an assessment, there's someone there to give it to them. And for the people who are really in need. Next slide, please. Recommendation 3, expanding specific services that can be provided prior to completion of assessment, especially among peers. In the current system, peers can only be reimbursed when working with individual in crisis situations or after an intake is completed. So what we're recommending in this recommendation is providing outreach services to individuals before an SUD assessment or diagnostic appointment, assisting individuals with reminders and transportation to SUD assessment appointments. So for instance, right now, if someone calls up and they're like, hey, I want an SUD assessment, and they're like, well, it's going to be a week before we can get to you, the person just sits there for a week, and there's no one that can really, outreach is approved. However, it's not reimbursable right now. So what we want to do is make it reimbursable. If not through Medicaid, then we also want to look at the dedicated cannabis fund as well as something that could also possibly fund this recommendation. So that if someone calls and says, well, it's going to be 3 days before you can get your assessment, a peer could do outreach and engagement with them and help them until they can get to their assessment, and provide ongoing services in the duration until an assessment happens. Next slide, please. Recommendation 4, expanding remote access pathways to receiving an SUD assessment and increasing virtual treatment options. So we want to partner with agencies and see what's going on in the world of telehealth, especially with the pandemic, the numbers and all that stuff, and how telehealth really just exploded during the pandemic, and how we can best help providers in expanding remote access to services. Next slide, please. We engaged with all the following associations. I sent emails to all of them. If for some reason I've said this at every meeting that I've had about SEDISA presentation, if you belong to one of these associations and you did not receive an email from that association about SEDISA and you're on one of the boards or something, I'm going to put my email in the chat. Let me know. I can reach back out to that association and confirm whether or not they got the information and such. And so if you're on one of those associations, just let me know and I'll look into it for you. Next slide, please. Do you have any clarifying questions about these recommendations?
Great, thanks, Kelly. I'm going to stop sharing. That's the end, I believe. Oh, and feedback from our group.
Yeah, if there's anything. No, it's just that. If there's any questions or feedback from anybody, I can take them right now. I don't see anything in the chat right now.
Okay, I'm just going to stop sharing so I can see the chat.
I do have a list. It's actually posted on our website, and I'll go ahead and post that to the chat as well if you guys, so everybody can see. It's public information about who the work group is. I will say that I feel like we got a couple from peers, King County, Franklin, Colum, Jefferson, Cowitz. So we got a few providers across the board from different counties. I'm going to post that. There's the roster for CISA.
Great, thank you. And then Matt said this would be great to provide support prior to the assessment. That's good feedback, I think. And there is slides in the chat. I will just go way back up here and copy and paste them. All of the slides that were presented today are in this. There we go. Okay. Anything else? We have 7 minutes left in this call. So do you have any questions about CDISA, about the behavioral health training program that we learned about suction updates, about stuff that you need help with, anything like that? I don't see any hand raised. I don't see any questions in the chat. Oh, I see a hand. Go for it. Therese.
Let me see. Can you hear me okay?
Yep, you sound good.
Okay, perfect. My name is Sharice Zell, and I am the Director of Behavioral Health Integration at Project Access Northwest in our pro bono counseling program. And I'm not sure if this is the appropriate place to speak about our program, but just was wondering, like, if you all had heard about it, or, you know, if there was an opportunity for me to speak maybe at another meeting to talk about it. It's pretty awesome, and a great way to give back as a provider.
Yeah, thank you. Reach out to me. I'll put my email in the chat. Reach out to me and we can look at our schedule and see what meetings are available. Anyone else on the call have heard of this program or want to know more? Do you have like an elevator spiel you could give kind of while we're here on the call? Okay,
Yes.
perfect.
So the pro bono counseling program, we provide free or pro bono counseling to those that are at or below 300% of the federal poverty level. That is literally the only requirement for a client. We don't have clients that are in crisis, any auditory or visual hallucinations. There's lots of benefits to becoming a provider. So once you're connected, we do a full screening of the client to make sure that they match what you want to see. This is also nice just because if you're giving your time back, you're actually seeing the clients that you would like to see. There's no limit to how many clients you can see. You can see one and you have access to the benefits that come with being a part of our program. So you're able to obtain free supervision hours from myself. I'm a licensed supervisor in the state of Washington. So let's say you were working on full licensure as an LMHC, I can provide those hours to you as long as you're seeing at least one of our clients. We have a partnership with Washington Mental Health Counselor Association for free CEs. So if you are a part of our program, you have access to all of their trainings for free, which is a pretty big deal. And then we also have our Ask a Therapist blog that you can contribute to, use some of our branding in order to get yourself out there if that's something that you're interested in, just to support destigmatizing behavioral health. But it's a very fun group, and we would welcome any providers that are interested in joining us.
That's awesome. Thank you so much, Sharice. And already you have a comment from Linda with NAMI, and she has her email and she would love to partner with you.
Oh, absolutely.
Oh, yeah. Go ahead. Sorry.
Yeah, and I'll put my email and all my info in the chat as well. So feel free to reach out to me. I also do like separate presentations, so I stay ready, so I don't have to get ready. And they're about 30 minutes, and I go through the program, how to sign up, and all of that. And once you do sign up, we also have a provider orientation that walks you through step by step on what this looks like for you, how you can participate with us, and just support us in building out this beautiful program.
Yeah, awesome. Thank you. That's really great. We do have a comment. I think anything is appropriate on this call, but somebody had a client when they were doing field work who needed assistance with ADLS and wanted inpatient SED treatment, and they weren't able to find any. It is a gap. Do we have any comments, questions, information? Any services that maybe they weren't aware of? Anyone wants to share? Oh, great. And then somebody else reached out wanting to know more. Yeah, go ahead, Stacy.
Oh, I was just going to say that we, if somebody has Medicaid personal care services helping them with ADLs, you can get a waiver so that those services can follow them into the residential treatment facility. So we've done that before when we had somebody who needed that hands-on assist in an SUD treatment facility.
That's great. That's wonderful. Thank you.
Hey, Stacy, real quick, this is Kelly. What organization are you with? I've never heard of that before. That's amazing.
I am with Sound Behavioral Health now, but it was in an old role that I did that. But you go through their home and community services social worker to try and get the waiver.
Okay, cool. Thank you so much. I appreciate the information.
Great. I love these calls for this reason. This is connection. It's great. We have 2 minutes left. Any other questions, comments that people need help with? Yeah, thanks, Robin. Okay. I'm going to be silent for at least 30 seconds. I know it's hard. I'm going to try.
Oh, wait. Can I ask you
go
something?
for it. You can,
I was wondering, like, if in the near future that, because I have a bachelor's degree, but I was wondering, can I get another one if I need to, or like if I have to go to the master's program and do my practicum hours that way?
That is a really, really great question for Rex. If you want to reach out to me, I will connect you with Rex, and I'm sure he can answer that. I don't want to give you the wrong information, so I will connect you with the experts. Yeah.
Okay, and what's your email?
I'll put it in the chat. Thank you.
Okay.
And then we have another question. Are SUDPs able to provide telehealth services, audio and video?
Yeah, I can answer this. Yeah, they can.
Okay,
SUDPs can, and they need to be both. It has to be both. It has to be, if it's telehealth, you got to do both. It's audio and video.
That's great. Thank you, Kelly. Yeah. Okay, and then there's some more information in the chat. Okay, we are exactly at 2:30, so I do want to be mindful of time, and I just want to close out and say I really appreciate this hour that none of us really have, but we all came together and we talked and we listened and we learned from each other, and that is so important, and I appreciate you and hope that all of you take care of yourselves as well as you do of those that you serve. Have a fantastic afternoon, everybody. Bye.
Thank you. Bye-bye.
Trying to get information out of the chat.